February is American Heart Health Month, and we will be on your side all month long with physicians from Baptist Health, letting us all know about the ways that we can keep your heart and our heart healthy. We begin today with Dr. Sarah Sandberg, a cardiologist with Baptist Health and Cardiovascular Associates. How are you doing?
Doing great. Thanks for having me.
Thank you for being here.
Thank you for having me.
I think we're specifically AFIB. I know it happens both in men and women, but if we keep it towards women, I guess a little bit, so to speak. But what is AFIB? What does it stand for, though, really?
Sure. So AFib is atrial fibrillation.
Okay.
It's the most common heart rhythm problem. It's an irregular heartbeat that comes from the top part of the heart. Basically, there's disorganized electricity that's happening up there, and it makes the amount of blood that goes through the heart to the bottom chambers different.
Right.
And so the irregularity is the main problem.
It does happen in everybody, does it?
It does.
Or
it happens in everybody.
It could,
yes.
yeah.
Yes.
Does it vary from a man to a woman, or what?
It can. So a lot of things that are different in women would be like the presenting symptoms. Sometimes women are going to be less likely to have what you would think of as classic symptoms with like palpitations, a racing heartbeat.
Right.
They might just have weakness, fatigue, maybe shortness of breath. They're also more likely to be diagnosed later in their course, and often by the time they are diagnosed, they have what we call persistent AFib, meaning that it's all the time, not episodic.
Right. Any particular symptoms that people need to be on the lookout for?
Well, I think it can be really variable. You know, it can feel like a fast heartbeat, an irregular heartbeat, but often just shortness of breath, fatigue, dizziness, weakness. I think if there's anything that seems concerning to you, it's always a good idea to get it checked out. And just the idea that AFib exists, I think, helps people figure out that they have it sometimes.
Yeah, I notice every once in a while when I get on the treadmill, I'll get a quickness of breath, loss of breath, but then I kind of slow down myself and I focus real quick, and it's gone just like the way that it came. So I'm not saying that I need to worry about anything or like that, but if we're going through this or diagnosed with AFib, what type of treatments are out there then?
Sure. So there's a broad spectrum of things. The first thing to know is that AFib increases your risk of a stroke.
Okay.
And so the main thing that we need to make sure of at first is just protecting people from stroke. Usually that's with medications to reduce the chance. And since we're focusing on women today, women are actually at a higher risk of stroke than men, even with the same medical problems. So it's even more important.
Why is that?
That's a great question. Maybe it's just from estrogen. It's just higher risk.
Right.
They just have a higher risk of stroke, even with everything else being the same.
So does treatment vary then?
It just means that you may be more likely to need treatment if you're a woman because of your stroke risk. As far as treating the AFib, the focus is going to be on controlling symptoms, probably on regulating the rhythm, trying to keep people in rhythm as much as possible. Ways to do that include medications, but also a procedure called catheter ablation, and then sometimes surgery.
Does it get cured, or is it just something that you have to live with?
Well, there's not really anything that cures AFib. We manage it, but with effective treatment and early treatment, we can often keep people free from AFib or very minimal AFib for a really long time.
There you go. Cardiologist, Dr. Sarah Sandberg. So thanks so much. And I'm fine, folks, okay? I really am. Believe it or not.
Come into my office
It's just me. I'm just out of shape. That's probably it. But never fear, we're in shape, bringing you more news right after the break. You're watching WBRC 6 News at Noon.